Health is of huge importance to all of us, and so ongoing developments in relation to Tay Sachs disease awareness has been welcomed by the UK Jewish community. The National Screening Committee, or NSC, is the executive agency of the UK government's Department of Health and has played an integral role in effective testing for the disease. Dr. Anne Mackey explains more.
It's a very rare condition. It predominantly affects a group of Jewish people from Ashkenazi backgrounds. If both parents have a gene, neither of them will be affected, but there's a 1 in 4 chance that their child will be. It's a condition where some chemicals collect in the brain, and the child will be born apparently normal, but over a period of 1 or 2 years will steadily decline and almost invariably dies early on in childhood.
Professor David Katz, who represented the Board of Deputies at a recent NSC workshop, believes that the screening process for the disease has improved.
What the board has felt at the time of the working party that we met before, as well as now in the more recent events, has been that a much more structured, clear approach that this kind of screening should be available for the people who are at risk, which is primarily the Ashkenazi Jewish population, that some kind of screening for them should be easily available within the health service provision. The National Screening Committee has said that they recommend that this screening needs to be available using most modern and up-to-date methods that are available to the Ashkenazi Jewish population. And recognizing that, and that National Screening Committee writing to the relevant National Health Service bodies and explaining that that is their view, is a step forward.
In addition to Tay Sachs, ongoing developments have been made in relation to Canavan disease and familial dysautonomia.
We looked at screening for Tay Sachs and familial dysautonomia and Canavan's disease and agreed that they were so tightly confined to a specific set of communities, Ashkenazi Jewish communities, that there were other better ways of screening for the conditions than screening the whole population. It's simply not right to do it for everybody when we know where the issue resides very powerfully. And what we're suggesting is that people who are at risk of Tay Sachs, familial dysautonomia or Canavan disease have the opportunity to go to a clinician and say, I think this is a problem. They have a conversation with a genetic clinician or a GP. They agree between them that it's a good idea and the test is done.
And it's very extraordinary in my working lifetime that it's changed to identifying the enzyme, to identifying the gene, to identifying the mutations in the gene, now to identifying screening and to identify a way of preventing it, and to now expand the screening into high-throughput genetic testing that can actually carry on and test for other diseases at the same time. That's an enormous change within one working lifetime, and one hopes that one will be able to avoid children suffering and families suffering the way that families suffered in the time when I first started to be involved in the subject.
The news has been well received by several Jewish organisations such as the Board of Deputies, Jewish Care and the Manchester Foundation of Jewish Services, who have worked to promote awareness of these diseases. With developments ongoing and continuing collaboration amongst organisations, there is a renewed hope that diseases like Tay Sachs will not prove to be so problematic in the future. This is Celestina Olalode for JN1 in London.